The LENSAR is my go-to system for all of my RLE patients as well as my femto cataract patients. I think that astigmatism management and precision of astigmatism treatment is really where the LENSAR excels. A lot of that has to do with the IntelliAxis L software. What that means is there are several diagnostic machines out there. We use Pentacam, there's others that can do the same thing, OPD3, a couple others. That data is uploaded from my office workup directly to the LENSAR wirelessly. So what that means is I'm able to orient my axis of astigmatism placement, whether I'm using a toric IOL or an arcuodecision. I'm able to orient that axis of cylinder placement with iris registration, and that's really the key. Because without iris registration, I would otherwise have to mark with a pen in the pre-op area and then hope I got that axis right, and then use some equipment to align a different axis away from that 180 kind of landmark. All of that's eliminated with iris registration. So with my Pentacam data, I've got the exact axis of cylinder, that's matched to the iris detail. And then what the LENSAR does in the case of a toric placement is it makes these little nubs, or I think they call them like IntelliAxis L marks, or whatever you call them. I call them nubs. But there are these little marks in the capsule that show me where to put my toric. I do use intraoperative aberrometry. I'm a big Aura fan. I like it for getting my power of not only the sphere but also the cylinder. I used to then do a second Aura scan for toric alignment. So I'd pick my power, put it in, rescan, tweak it this way, tweak it that way until we got that little NRR, no rotation required. Now I only scan for power because when I put my toric in, I know automatically I'm in the right axis based on the iris registration that we had from our pre-op data. So from getting the precision of my astigmatism treatment, the LENSAR is the only one that does that. And I really like that. So anytime I'm doing a toric multifocal, toric regular, or even just arcuate incisions, I think I'm getting a more precise axis with the LENSAR.